As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Leyla Muedin. This is the Intelligent Medicine Podcast. Thanks for joining us. Thanks for downloading these podcasts. As you know, you find them at drhoffman.com. You can go there anytime. You can read articles. You can download and listen to podcasts. There's all kinds of good information there that we like to bring to you. Questions, if you want to email me any questions, topics of interest, that email is questions@drhoffman.net. That's questions@drhoffman.net. I have a question from Mike from New York, and he says, I just read your latest Ask Leyla post, and the latest was actually not the latest. You're getting this podcast on February 20, but on February 5th, we have an article on what does my elevated LDL say about my heart risk, which is the article that Michael is referring to. So Michael's question, he says, I have similar numbers. I have an HDL of 57, triglycerides of 62. Mike, those triglycerides are terrific. LDL of 107, that's pretty good too, because they like to see it under 130, the LDL. But Mike says a calcium scan I requested a year ago, it says simply for a benchmark was 77, which I'm not sure I'm understanding what you wrote, but I'm just going to take it as you have a calcium score of 77. And Mike is asking, does anything concern you about this calcium score with those numbers? Well, here's the thing. Just like in the article I write, which is similar, because in the article, this person's LDL was 173. Mike's LDL is 107, which is lower. But, triglycerides at 62 is very good. Mike, your HDL of 57, I wish it was in the 60s or 70s. That's the so-called protective cholesterol, the high-density lipoprotein, HDL. But, Mike, you include a calcium score, 77. Now, I know that Dr. Hoffman would say that anyone with a calcium score should probably strongly consider taking a statin. This actually requires a conversation with your doctor. You need to have this conversation with your doctor about the benefits versus the risks. And Mike, I don't know your age. Are you 45 years old with a calcium score of 77? Or are you 75 years old with a calcium score of 77? Because the answer may be different. And you and your doctor may decide, depending on what age you are, whether a statin is right for you, which statin is right for you, which dosage is right for you. A lot of you out there are considering red yeast rice, but red yeast rice is also, it has statin in it. So, and the same with if you were taking a Lipitor, Zocor, Crestor, rosuvastatin, atorvastatin, all of those, we need to still monitor your liver function tests, your liver enzymes, the AST, the ALT, to see if the statin is doing anything. Even if you were taking a natural supplement, red yeast rice still has some statin in it, and your liver function tests still need to be monitored, right, by your doctor or your healthcare practitioner. So here's the thing, and Mike, the same would be for you. You have a calcium score. So really my answer to you would be you need to have a conversation with your doctor and or your cardiologist about taking a statin or not, or something different. Now, here's the other thing. In my article, I say get a VAPs test and NMR test to see what type of LDL particles. You want to know, Mike, if your LDL, if you have a high amount of small, dense pattern B atherogenic particles, that maybe this is contributing to that calcium score of 77. It's hard to tell. You also want to check for homocysteine. If you have a high homocysteine, that alone, or in combination with other things, could be the contributor to your calcium score of 77. You want to get a high sensitivity C-reactive protein. The HS-CRP is an important test because it's a marker of inflammation that's specific to coronary arteries, as I described in my newsletter article from February 5th. And another crucial test, Mike, is lipoprotein a. And that's a more critical risk factor along with these other tests. So you have a calcium score. It'd be interesting to know if you have a high lipoprotein a, because that could be the contributor to this calcium score of 77, not necessarily your LDL at 107. Right? So that's the thing. And another thing to talk about here with regard to Mike's question is that's coronary arterial calcification. Now, it is also said that the calcified plaque, which is the coronary artery calcification score of 77, this is said to be stable plaque because it's hardened, it's calcified, it's stable plaque. Some more important numbers might be the soft plaque. There is a test called Clearly. Clearly is spelled Cleerly. Cleerly. Clearly is the test, and they measure soft plaque because that is a greater risk factor. It starts first as soft plaque, which then calcifies into a more stable plaque. That's your body protecting the coronary arteries by changing over any soft plaque into a calcified plaque, right? This is a contributor to the coronary arterial calcium score, the CAC. Now, this Clearly test, please be warned, it's a very, very expensive test. You know, it ranges anywhere from $1,500 to $2,200, depending on where you are or what. These numbers change. You have to check with your insurance what's covered or what's not. It's a very expensive test. But again, it's something to have as a conversation with your doctor, your cardiologist, about having that type of test, and then what you may do going forward with the results. But Mike, for you, you know, it'd be interesting to know your lipoprotein a, your HS-CRP, your VAPs or NMR test, to see what's going on there before getting the Clearly test. Because if you have, small dense LDL, you could change that with diet. If you have a high lipoprotein a, that's a little tougher nut to crack because it's said to be genetic. But there have been some findings in the recent research that going on a very low carb, high fat diet, not a Mediterranean diet, I want to be clear, not a Mediterranean diet. A Mediterranean diet has not been shown to be useful for lowering lipoprotein a. However, there is some indication that a high-fat, low-carbohydrate diet helps to lower lipoprotein a. And this is very encouraging news. So the fats are not to be demonized here. This is very important. So, Mike, I want to thank you for your question. And in this regard, in this vein, pun intended all over the place, there's hidden cardiovascular risk of insufficient vitamin K and folate intake. This is from innovision.com. For many, cardiovascular conditions can begin in their 20s and progress with age. And this is often linked to nutritional deficiencies, including vitamins such as vitamin K and vitamin B9. B9 is folate, which have been shown to support heart health and function. Clinicians from the Cleveland Clinic Foundation have stated there is an alarmingly high prevalence of vitamin K deficiency and suboptimal recommended intake among the general population in the U.S. Emerging research suggests that higher intakes of vitamin K, and we're talking about vitamin K2, menaquinone, which may be needed to help protect arteries and bones. In addition, approximately 54% of the world's population does not consume enough folate from food. According to a study from 2025, nearly 3 out of 4 women of reproductive age, that's approximately 73%, have folate levels below levels considered necessary to help combat neural tube defects. Spina bifida is what they're talking about. This means they are also not receiving the lesser-known cardioprotective benefits of folate. While many people have insufficient intake of these vitamins due to nutrient-depleted Western diets, which can leave them vulnerable to heart issues in the future, science continues to confirm the potential of simultaneously addressing both. So let's talk about the impact of nutritional deficiencies. Vitamins K2 and folate, which is vitamin B9, have been repeatedly identified as essential for healthy outcomes, not just for heart health, but for bone health and fertility, respectively. Yet, both remain elusive for most to obtain through diet alone. It is most difficult, says a researcher, for most consumers to overhaul their current diets as the convenience of preparation and increasingly of procuring is the top priority, resulting in low levels of key nutrients. Now more than ever, supplementation to fill the gaps is easy and attractive. Now, I want to remind everyone vitamin K2 is found, menaquinone is found in meat and in dairy, as well as in natto. Vitamin K1, which is not what they're talking about here, K1 is found in dark green leafy vegetables, salads and things. K2 is what they're talking about. It's found in meat and in dairy and in natto. The Council for Responsible Nutrition estimated that vitamin K2 use could reduce coronary artery disease events by 15.7% and save the U.S. healthcare system $9.48 billion. Wow. Vitamin K2 has been shown to protect heart health by helping the body manage calcium deposition, inhibiting it from settling into arteries and soft tissues. Meanwhile, folate supports vascular function via homocysteine metabolism, and pregnancy outcomes increasingly serve as an early warning signal for a woman's future cardiovascular risk. We know that folate helps to lower homocysteine, along with riboflavin, vitamin B2, as well as vitamin B12 and trimethylglycine, because a high homocysteine level is an independent risk factor for cardiovascular disease. That's what I said early on, that Mike should have his homocysteine levels checked. Coming back to this about folate and vitamin K2, researchers say, but if we look at the potential dangers associated with suboptimal vitamin K and folate intakes, these deficiencies may contribute to increased cardiovascular risk by increasing arterial calcification, vascular stiffness, impaired homocysteine metabolism, and endothelial function. So while calcium is essential for bone health, its precipitation in blood vessels is harmful to the cardiovascular system. Vitamin K2 controls soft tissue calcification by activating the vitamin K-dependent protein called matrix GLA protein, MGP, a key inhibitor of vascular calcification. Low vitamin K status is determined by inactive MGP and is therefore strongly associated with arterial stiffness, vascular and valvular calcification, and resulting heart failure and eventual cardiovascular mortality. Well, here's the good news. Higher vitamin K2 intake has been linked to improved arterial health and reduced cardiovascular risk. In fact, each additional 10 micrograms of vitamin K2 is associated with a 9% lower risk of coronary heart disease and reduced cardiovascular mortality. So, human intervention studies show that long-term MK7 supplementation, MK7 supplies you with K2, which is what we're talking about. It improves vascular elasticity, and in subpopulations with elevated arterial stiffness, supports healthy blood pressure, particularly among postmenopausal women. So, meanwhile, folate's cardiovascular relevance is largely driven by its role in homocysteine metabolism, as I just explained to you earlier, and endothelial function. Large cohort studies and meta-analyses published between 2022 and 2025 consistently associate higher folate intake with lower cardiovascular and all-cause mortality, especially in metabolically vulnerable populations. Each increase in folate intake was associated with a 5% lower risk of total cardiovascular disease events and a 10% lower risk of cardiovascular disease mortality, highlighting its potential benefit for cardiovascular health. However, these positive results do not reflect folic acid, the more commonly consumed vitamin B9, which requires an important in-body conversion to an active form of folate, which is the MTHF. Further, approximately 40% of the population has an enzyme deficiency, rendering their bodies incapable of fully converting to 5-MTHF. If you have that genetic defect, so to speak, that genetic mutation, which is fairly common, right? The MTHFR, you may be one of those. So you need the methylated forms. So quatrefolate, active folate, is a well-studied active folate with research substantiating and quantifying its benefits in several contexts for women's health, including overall folate metabolism, cardiovascular health, as well as fertility. So, together, vitamins K2 and folate, they address two complementary cardiovascular pathways. Calcium regulation. K2 facilitates the activation of NGP, which is that protein, matrix GLA protein, helping to inhibit arterial calcium deposition while supporting bone remineralization. It's taking it out of the soft tissue, out of the arteries, and directing it back to the bones. That's what vitamin K2 helps to do. And methylation and endothelial support. Active folate supports healthy homocysteine metabolism and vascular health. And both ingredients are clinically validated. Numerous human studies demonstrating positive effects on heart health. As heart health conversations evolve beyond cholesterol alone, please God let it, because it's not all about the lipid panel. The combination of fat-soluble vitamin K2 and water-soluble active folate offers a compelling, science-driven narrative for American Heart Month 2026, which is February, focused on vascular aging, prevention, and long-term cardiovascular resilience. Quote, with a large portion of the population likely subclinically deficient in both K2 and folate, the opportunities for closing those gaps and providing heart health and other wellness attributes with taking K2 as MK7 and, the beneficial form of folate are extraordinary. This is important information. To remind you, vitamin K2, as in the supplement NK7, we generally require, 180 micrograms a day, as high as 320, 360 micrograms a day. For those of you using statin, Crestor, Zocor, Lipitor, it manipulates vitamin K metabolism in a downward way, in a not desirable way, which then increases your needs for vitamin K. If you're taking a statin, you definitely need to be taking vitamin K2, absolutely, to help support that, because statins, mess with vitamin K metabolism and therefore have been shown in past studies to actually contribute to to arterial calcification. But again, it's a little bit of a conundrum because calcified plaque is less dangerous than the soft plaque that I talked about earlier. All of these are the things to be having a conversation with your doctor, your cardiologist about. I want to thank you for joining me on another edition of Leyla Muedin. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.